So I've been a nurse for a little over 15 years now. And you know what? It's a lot different than I thought it would be when I got interested in becoming a nurse. So if you're considering nursing as a potential career choice, this video was made just for you. So when I first decided to make this video, it was mainly for an individual who wants to become a nurse, just wanted a little bit more background information. So instead of sending that person an email, I thought, why not make a video just in case there's other people that might want to know what it's like to be a nurse or how you even get started if that's what you want to do. So the first tip I can give you is if you think you want to get into the medical field, my advice is to become a CNA first. A CNA is a certified nursing assistant. This is a fantastic way for you to get your feet wet, find out what it's really like to be in the medical field, and see if it's the right fit for you. Being a CNA is a great introduction into the world of healthcare. You'll do a lot of things like giving baths to people, changing diapers, not only on babies, by the way. You'll get to learn a lot of different medical terminology, and you really get to interact with people as a healthcare professional and the patient. I think that's probably one of the biggest takeaways that you can learn as a CNA, along with learning a lot of compassion skills and time management. And when you get into nursing school and doing clinical rotations, things like that, having time management to balance all of your projects, all of your classes, and your life outside of school is a big deal. And being a CNA, actually, it's a paying job, so you can earn money while you are in nursing school. And there's a lot of different job opportunities for CNAs. You can work in a skilled nursing facility, which is also called a nursing home. You can work in a hospital. Sometimes you can even work in a clinic setting like a doctor's office. And the best part is while you're actually working in the healthcare field, the stuff that you'll learn while you're working will actually help you when you are in the process of becoming a nurse. So like through your classes and even your clinical rotations. It kind of gives you a leg up because you're already doing different skills that you will need to do as a nurse. And once you've been a CNA, it really gives you some insight, and you will really appreciate the CNAs that you have working with you when you become a nurse. So if you've already decided that nursing is for you, then you have to actually go through the process of getting your degree. And you have to decide what degree would be right for you. Now, today we're really lucky because there are so many different colleges and even like private institutions that offer nursing programs. There are ADN programs, there are BSN programs, there are accelerated programs. So like if you already have a degree, it makes it easier for you to get your nursing degree. And since we all seem to learn differently, there's a lot of different programs out there for you to become a nurse. For example, when I went to nursing school like 18, 19 years ago, things have changed a little bit, but it was very competitive to get into a nursing program. Even a 2-year ADN, which is an associate's degree nurse, it was very, very competitive. The wait list was over 2 years long. So I decided to go a different route. I went to a school where I got my LPN certification, which is called a licensed practical nurse. It was a 1-year program, and it really helped me to get a job as an LPN while I was waiting to get into a program to become a registered nurse. And I was also very fortunate that about a year later, the University of Phoenix offered a program which was an LPN to a BSN program. So by completing some prerequisites for my bachelor's degree, I was able to start the program, and 3 years later, I graduated with a bachelor's degree of nursing. BSN. And for me, that program worked great. I was able to work full-time while I was still in school and achieving my dream of becoming a registered nurse. 3 years later, that happened. But I'm getting a little bit ahead of myself. I was talking about some of the programs that they have. Community colleges have nursing programs as well as four-year colleges do. And nowadays, they even offer online nursing programs. Now, for me, that wasn't really a good option. And I kind of steer people away from doing an online nursing program because a lot of times when you're in a program like that, they leave it up to the student to find their own clinical rotations. If you go through a traditional program, either a community college or a private institution or a university, they will line up all of your clinical rotations for you, which is way easier. You do not want to be responsible for trying to come up with your own clinical sites. So all of this education that you're going to be going through is basically helping you to prepare for the NCLEX exam. And the NCLEX exam is a nursing exam that is administered to potential candidate nurses, either practical nurses or registered nurses. And basically all of the clinical work and classroom work that you're doing in your nursing program is to help get you ready for the NCLEX exam. Now, I can honestly say that I haven't looked at what it takes to get into a nursing program today. Like I said, it was probably 19 years ago when I went through my own nursing program. So it's been a while, but I'm sure it's probably pretty similar, and it is very competitive to get into a nursing program. So the best thing that you can do to help your chances of getting in are do all of your prerequisites and make sure you get the highest grades that you possibly can in those prerequisite courses. It probably wouldn't hurt to also have some volunteer experience, and also maybe if you're a CNA, that can definitely help edge your chances of getting in. And speaking of getting into a nursing program, you want to look at the application process like you're writing a resume. You want to make yourself look as good as you possibly can on paper so that you can really stand out and hopefully get into the program. Do everything you can in your prereq classes to make sure that you are going to have the highest GPA as possible, which will help you in turn, hopefully, get into your nursing program. Okay, so let's say you found the school that you want to go to because it has an awesome nursing program and you're stoked, you're ready to go. Well, just because you got into the college doesn't necessarily mean that you're going to get into the nursing program. The nursing programs themselves, especially for like a Bachelor of Science program, it's about 2 years long. So the first 2 years of your college is going to be the prerequisites to get into the program. Now, do you understand why I said make sure you do good on all of your prereq classes? It's really important for when you are going to be actually applying to the program that you want to get into. And let me tell you, even though this was many years ago that I got accepted into a program, when you get that acceptance letter from the nursing program that you want to go to, you are going to be so excited. Hands down, that is going to be one of the happiest days of your life. You've worked so hard for this and you finally got into a program. You are going to be stoked. And even if you're a really reserved person, I'm telling you, you are going to be super excited. And you should be, because it's a really big deal. So let's say you've done all your prereqs and you've applied to your nursing program and you got in. Yay! Yay for you. Have your little party because you deserve it. That's a lot of work in itself. But now is when the real work is going to begin. When your classes start, be prepared to study. And if there's different things that help you study, like memorization or flashcards, things like that, these can be really important to help you in the pursuit of your nursing degree. Not only are you going to be in the classroom doing lots of book work and lots of studying, I'm serious, lots and lots of studying, but you're also going to be doing clinicals. And clinicals are where you actually get to go to different hospitals or doctor's offices, urgent care centers sometimes, and you get to put into practice what you're learning in your classes. This is so much fun, but if you're shy, it can be a little bit overwhelming too. If you're watching this video and you don't get anything else, please get this point. This is like the most important part. When you do your clinical rotations, that is where you are really going to get the concrete information that's going to go in your brain that's going to help you on your state board exam when you get ready to graduate. So when you're at your clinical sites and you're in your clinical rotation, do everything you can to learn as much as you can and learn practically. So if they give you chances to do things like drawing blood or, I don't know, giving injections, giving medications, take those opportunities and take as many as you can. There will be some people that just really don't feel like doing that and they're just there going through the motions. But if you want to get the most out of this and be the best prepared that you can, Really seize those opportunities. Learn all that you can about dressing. Learn all that you can about doing an assessment, a head-to-toe assessment. Follow your preceptor nurse around and literally watch what she or he is doing throughout their day. Documentation is huge. Some places have computers, thankfully. Other places are still using paper charting. Make sure that you are looking at examples of how to do charting. Do they do S-bar charting or do they do SOAP charting? Every clinical rotation will present different things that you can learn, and you really owe it to yourself and your future career to seize those opportunities. And I know when I started nursing school and was getting ready to do clinicals, I had a goal in mind of what kind of nurse I wanted to be. I was certain I was going to be a labor and delivery nurse. That's what I always wanted to do. And so that's what I was really focused on. But when you're in your clinical rotations, you might find out that the career path that you thought you wanted really isn't what you want to do. So for my example, I wanted to be a labor and delivery nurse. And when I got to that point, it really wasn't for me. I really felt kind of let down because I was like, this is what I've always wanted to do. So this is why it's so important to experience as much as you can in your clinical rotations. You'll have med-surg rotations, you'll have pediatrics, you might have the opportunity to do some emergency room work, and you might have opportunities for specialty clinics as well. Really just learn everything you can about whichever field you're in during that rotation. You might find you love med-surg when you thought you wanted to do labor and delivery, or you might find that med-surg isn't your thing, but cardiology is. So many different opportunities for you as a nurse, and the more experiences that you open yourself up to while you're in your clinical rotations, the more likely that you are going to find exactly what kind of nurse you want to be. So like I said, I thought I was going to be a labor and delivery nurse, and on sheer accident, I ended up, my first job as a nurse was working in an orthopedic department, which is where I still work. And you know what? I love it. I am so grateful and so happy with my job. I've been there for 15 years in the same orthopedic department, and I've actually specialized even a little bit further because I have my advanced wound care certification. So I'm wound care certified, which I didn't know that I would really like doing either. But that's what's so fun about being a nurse is you can pretty much do whatever you want. You can try pediatrics for a while, and if you really like it, then you can get even more specialized into something like cardiology for peds or even orthopedics for kiddos. You just have to keep an open mind and see what really just excites you about nursing. So I guess long story short, don't tie yourself to one idea of what kind of nursing you want to do or where you want to end up. Try everything that you can in school and see what calls to you and what fits you the best. Nursing as a profession is pretty incredible, I have to say. It isn't always easy, but it's pretty awesome because you can reach people on so many different levels. You have the opportunity to save lives, you have the opportunity to change their lives, and you get to be a real superhero. And like I said earlier, nursing has so many different options. As your experience grows, your career can grow also. You can be a nurse for as long as you want. Depending on if you get further educated, you could end up teaching future nurses. You could do research. You could be a nurse anesthetist. You could even get your doctorate in nursing. So you could be a nurse doctor. So instead of an MD, you would be an ND. That would be pretty cool. Something that is really important to keep in mind and will help you when you're in nursing school and your career for that matter. And this is critical thinking skills. And critical thinking skills are basically learning how to think critically. Does that make sense? So the sooner you start to learn how to think critically in your everyday life, the easier it will be for you, and it will actually be easier for you in school. And critical thinking is basically learning how to take all of the information, prioritize what is important to do first, and then you just work down the list of figuring out what is the next most important thing to do. Nurses do this on a daily basis, hundreds of times a day, most likely, every time that they're taking care of their patients or getting report from other nurses. Critical thinking skills are very valuable. And the first place that you're going to learn this outside of the classroom is when you take your NCLEX exam. The NCLEX test is hard. I know, I've taken 2 of them. I took my NCLEX for my practical nursing so I could become a licensed practical nurse. And then I took the NCLEX exam again for my registered nurse. And this is why critical thinking skills are so important. So start practicing now. You want to think through things and you want to take what is the most important thing, most critical thing that you need to do first. This is something that you will be using on a daily basis as a nurse. Something else that will really help you in your quest to become a nurse is time management skills. There are so many things that you're going to be doing in between your classes, your clinical rotations, your studying, and probably a little bit of a personal life too. So the better you are at managing your time, the easier it will be for you to get everything done that you need to get done. Okay, so there are literally thousands of different things that I could talk to you about. What it's like to be a nurse, what it's important for you to do as a nurse, and how great it is to be a nurse. But if there was just one thing that I had to focus on, I would say that if you're looking for a stable career, you love helping people, you enjoy making a difference in people's lives, then nursing might be a good career choice for you. I know I love what I do, and even though I went to school to be a nurse a lot later than most people did, it was hard. I had a full-time job. I had 3 kids. For a lot of that time, I was a single parent. But you know what? It was worth it, and I would do it all over again. All right, I know that is way different than any video that I have ever done on my channel. But like I said, there was someone that wanted to know what it was like to be a nurse, what to expect in nursing school. And I just thought it would be fun to kind of just ramble on a little bit about some of the process that you have to go through in order to be a nurse. So maybe nursing would be good for you. I don't know. But if not nursing, there's always YouTube, right?